If you've recently been prescribed amitriptyline, you might think it's simply an antidepressant. But what if I told you that millions of people take amitriptyline for reasons that have nothing to do with depression? In fact, many patients are surprised to learn that this medication can affect sleep, pain, nerves, mood, digestion, and even headaches. While amitriptyline has been around for decades and remains one of the most commonly prescribed medications in the world, many people still don't fully understand what happens inside the body after taking it. Some of its effects are expected, while others may come as a complete surprise. That's why today we're going to uncover 7 hidden effects of amitriptyline that many patients never hear about until they experience them for themselves. Some of these effects can be beneficial, while others may be side effects that are important to understand before starting treatment. Hidden effect 1: it may improve sleep. Before it improves anything else, one of the first things many people notice after starting amitriptyline is that they begin sleeping better. In fact, some patients are surprised because improved sleep often appears before any improvement in pain, mood, or other symptoms. Amitriptyline affects several chemicals in the brain, including those involved in regulating sleep and wakefulness. As a result, many people find themselves feeling sleepy shortly after taking their dose. For patients who have struggled with insomnia, chronic pain, anxiety, or frequent nighttime awakenings, this effect can feel like a major benefit. Some people report falling asleep faster, while others find they stay asleep longer throughout the night. Doctors sometimes even prescribe low doses of amitriptyline specifically to help patients sleep better. However, this effect isn't always positive. During the first few weeks, some individuals experience morning grogginess or daytime drowsiness. Fortunately, many people find that these symptoms improve as the body gradually adjusts to the medication. Hidden effect 2: it can treat nerve pain even if you don't have depression. Many patients become confused when their doctor prescribes amitriptyline for pain. They often ask, "Why am I receiving an antidepressant when I'm not depressed?" The answer lies in how amitriptyline works inside the nervous system. This medication doesn't just affect mood. It also changes how pain signals travel between the nerves and the brain. Because of this, amitriptyline has become one of the most widely used medications for nerve-related pain conditions. Doctors commonly prescribe it for diabetic neuropathy, sciatica, fibromyalgia, post-herpetic neuralgia after shingles, chronic back pain, and other nerve disorders. Patients with nerve pain often describe symptoms as burning, tingling, stabbing, electric shock sensations, or pins and needles. Amitriptyline helps reduce these abnormal nerve signals, making the pain easier to manage. Some patients experience significant improvement after several weeks of treatment, even though they never had depression to begin with. This is one of the reasons amitriptyline remains so valuable in modern pain management. Hidden effect 3: it may reduce frequent headaches and migraines. Another surprising effect of amitriptyline is its ability to help prevent headaches and migraines. Most people think of headache treatment as taking medication after the pain starts. Amitriptyline works differently. Instead of treating an active headache, it may help reduce how often headaches occur in the first place. Doctors frequently prescribe low doses to patients who suffer from chronic migraines, tension headaches, or frequent recurring headaches. Researchers believe amitriptyline helps stabilize certain pathways in the brain that contribute to headache development. Over time, patients may notice that headaches become less frequent, less intense, or easier to control. Because the improvement often develops gradually over several weeks, many people don't immediately realize that the medication is responsible. However, after a few months, some patients discover they are experiencing far fewer headache days than before treatment began. Hidden effect 4: it can cause weight gain. Now, let's discuss one of the most talked about side effects associated with amitriptyline: weight gain. While not everyone experiences it, weight gain is common enough that patients should be aware of the possibility. Amitriptyline can increase appetite in some individuals, causing them to feel hungrier throughout the day. Some people notice stronger cravings for carbohydrates, snacks, or comfort foods. In addition, because the medication may cause drowsiness, certain patients become less physically active, which can further contribute to weight gain. Improved sleep may also influence metabolism and eating patterns. The amount of weight gained varies greatly from person to person. Some patients gain only a few pounds, while others experience more noticeable changes over time. This doesn't mean weight gain is unavoidable, but maintaining a healthy diet and regular physical activity can help reduce the risk. Hidden effect 5. It may cause dry mouth, constipation, and blurred vision. One of amitriptyline's lesser-known effects involves how it influences certain automatic functions of the body. The medication can reduce saliva production, which often leads to dry mouth. Patients may find themselves drinking more water than usual or constantly feeling thirsty. Some people describe a sticky feeling in their mouth or notice dry lips throughout the day. Amitriptyline can also slow movement through the digestive system, making constipation another common complaint. For some individuals, this becomes one of the most frustrating side effects of treatment. Additionally, blurred vision can occur, particularly when first starting the medication or after a dose increase. These effects are usually not dangerous, but they can affect daily comfort and quality of life. Understanding these possibilities ahead of time helps patients know what to expect and prevents unnecessary worry if symptoms occur. Hidden effect 6. It may reduce anxiety and emotional stress. Although amitriptyline was originally developed as an antidepressant, many people notice improvements in anxiety levels as well. Living with chronic pain, migraines, sleep problems, or ongoing health issues often creates significant emotional stress. Over time, this stress can worsen symptoms and create a cycle that becomes difficult to break. Amitriptyline affects neurotransmitters such as serotonin and norepinephrine, which play important roles in mood regulation and emotional well-being. As treatment continues, some patients report feeling calmer, less overwhelmed, and better able to handle everyday challenges. They may find that stressful situations no longer feel as intense as before. While amitriptyline is not a cure for anxiety, its effects on brain chemistry can provide meaningful emotional benefits for certain individuals. Many patients find that improved sleep, reduced pain, and a calmer mind work together to improve overall quality of life. Hidden effect 7. It can improve your life in multiple ways at the same time. Perhaps the most interesting hidden effect of amitriptyline is that many patients simply feel better overall without immediately understanding why. After several weeks or months of treatment, they notice that their sleep has improved, their pain has decreased, their headaches occur less often, and their mood feels more stable. They may have more energy during the day and feel more capable of handling daily activities. Yet when someone asks exactly what changed, they struggle to identify a single reason. This happens because amitriptyline often affects multiple body systems simultaneously, rather than producing one dramatic improvement. It creates several smaller benefits that gradually add up. Over time, these combined effects can significantly improve quality of life. For many patients, this overall improvement becomes the most valuable effect of all. While amitriptyline can be highly effective, it is important to remember that every medication carries potential risks. Common side effects include drowsiness, dizziness, dry mouth, constipation, blurred vision, increased appetite, and weight gain. Some individuals may experience stronger side effects than others. Patients should never stop amitriptyline suddenly without consulting their healthcare provider. Abruptly stopping the medication can lead to withdrawal symptoms such as headaches, nausea, irritability, anxiety, sleep disturbances, and mood changes. Doctors typically recommend reducing the dose gradually when treatment needs to be discontinued. Regular follow-up appointments can help ensure the medication remains safe and effective. Today, amitriptyline is prescribed for a surprisingly wide range of conditions. Doctors commonly use it for depression, anxiety-related symptoms, chronic nerve pain, fibromyalgia, diabetic neuropathy, sciatica, migraine prevention, tension headaches, and sleep problems associated with chronic pain. Its versatility is one reason it has remained popular for decades. Even with the availability of newer medications, amitriptyline continues to play an important role in pain management, neurology, and mental health treatment. Amitriptyline is much more than just an antidepressant. It can influence sleep, nerve pain, headaches, anxiety, digestion, appetite, and overall quality of life. Some of its hidden effects are beneficial, including better sleep, reduced nerve pain, fewer migraines, and improved emotional well-being. Others, such as weight gain, dry mouth, constipation, and drowsiness, may require careful monitoring. Understanding these hidden effects allows patients to know what to expect and use the medication more safely and effectively. The most important thing to remember is that amitriptyline usually works gradually. The biggest improvements often happen slowly, making them easy to overlook at first. But over time, many patients discover that they are sleeping better, hurting less, feeling calmer, and enjoying life more than they did before treatment began. That's why amitriptyline remains one of the most trusted and widely used medications in modern medicine.